Okay, welcome everybody. We are bang on 12 o'clock, so we're going to make a start. I'm going to pop my camera off and start the presentation. It'll just help with a little bit of kind of the background feedback. So just bear with me 1 second. Okay. So just a little bit of housekeeping before we start. If I can just ask you to make sure your microphones are turned off. Ideally, if cameras can go off, it just helps when we cut the video back and pop it on the YouTube channel. We will be kind of hopefully having time at the end of the session. We've got a lot to cover today in terms of content, but we will try and make sure there's time at the end for you to have any kind of discussion or chat. I'll be kind of manning the chat bar as well as much as possible. So just to introduce myself, my name's Kat Morrison. I'm a Policy and Development Officer for North Yorkshire Safeguarding Children Partnership. And I'm really thrilled today that we've got a real full kind of partnership presentation. So I'm just going to go around and just ask partners who are contributing today to say hello and introduce yourselves. I don't think we've got Emma, but oh, we have got Emma. She's just popped up. Emma, would you mind just saying a quick hello? Just introduce yourself just as we're making a start.
Good afternoon, everybody. My name is Emma Bedford. I'm the Detective Inspector for the Safeguarding Vulnerability Assessment Team, North Yorkshire Police.
Thank you, Emma. Jo, can I come to you to say hello, please?
Yeah, good afternoon, everybody. I'm Jo Miles. I'm the Children and Families Principal Social Worker in North Yorkshire.
Al, do you want to say hello?
Hi everybody, Al Westcott from North Yorkshire Council in Community Safety, and I've got the portfolio around domestic abuse.
Thank you. Claire, do you want to say hello?
Hi everyone, I'm Claire Wallace. I'm Lead Nurse for Safeguarding and Children in Care for HDFT. We cover a large footprint. One of that is North Yorkshire, so it's really health visiting, school nursing, and the acute for North Yorkshire today.
Thank you, Claire. And we've got a full house. Elaine, do you want to come in and say hello, please?
Hi, sorry, I'm a few minutes later.
My
name's Elaine Hawkett. I'm the Senior Nurse for Safeguarding Children for Tees, Esk and Ware Valley.
Thanks, Elaine. Okay, so just to kind of give you a bit of an overview of our masterclass session today, please pop your microphones on mute. Thank you. So the masterclass session today, we're looking at the work that's been done by the partnership following the release of the Child Protection in England report. Now, this came out in May 2022. So we are going to have a very brief case overview, cover some of those key learning recommendations, and then I'm going to hand over to all of our partners here today who are each going to give a little bit of an update from their service. We're going to share some key learning resources that we've put together, as well as hopefully having a little bit of time looking at some of those questions for reflection. As I've already said, we've got loads to cover in an hour's session. We will try and have that time at the end if anyone's got any questions. I'll make sure that I put my email at the chat at the end as well. So if anything does come through at the end, we can follow it up with partners. Final ask from me at the end of the session, we will be posting a link for a SNAP survey, just so we can gather a little bit of feedback from the session today. So please take another 30 seconds at the end of the session to just fill that in, please. Really important one for me, this one, is to just kind of be really mindful that we are obviously talking today about the very tragic deaths of two children. We are going to be giving a general overview of the cases as part of the session. We won't be going to any sort of specific details about the case. That's all sort of covered much more thoroughly in the report. And it's really vital to consider what happened in terms of learning. But we know that the death of children is always a very difficult topic, especially when partners are reflecting on the learning that's come out of that. So please do take the time that you need to. If you need to come out of the meeting, please do, and we'll let you back in quite happily. And make sure you take some time for yourself after the meeting as well. Okay, so I would like to start by just telling you a little bit about Arthur and his story. I won't go into the full details of his life. Like I said, these can be accessed in the full report. However, it's really important to remember that Arthur was a little boy who loved playing cricket and football. He enjoyed school, had loads of friends, and was always laughing. Arthur died in Solihull, aged 6 years old, on the 17th of June 2020. Now, on this slide, you can see a timeline of some of the key events shared in the report that occurred in Arthur's life leading to his murder. Emma Tustain, who was Arthur's father's partner, was convicted of Arthur's death in 2021, and his father was convicted of manslaughter. Now, if we look at Star was an inquisitive toddler who loved to listen to music and would dance in her baby walker, laughing and giggling. She died in Bradford, aged 16 months, on the 22nd of September 2020. Her mother's partner, Savannah Brockhill, was subsequently convicted of murder on the 15th of December 2021. And her mother, Frankie Smith, was convicted of causing or allowing her death, and they too are now in prison. Now, again, I won't go through the details, but on the slide you can see some of those key events in Star's life that led to her sad murder. Now, Arthur and Star were both killed in 2020 as a result of sustained abuse and neglect by their caregivers. Professionals and family members had previously thought that their parents capable of providing that good care to them. However, wider family members voiced multiple concerns and shared evidence of physical abuse with professionals prior to their deaths, and there was also a history of domestic abuse in both cases. Now, the full report into Arthur and Star's death shares multiple findings and national recommendations. Now, these included the key findings, which in analysing what happened to Arthur and Star and how public agencies responded, they identified a set of issues which hindered professionals' understanding of what happened to Arthur and Star. So the key ones here that came out were those weaknesses in information sharing and seeking within and between agencies, a lack of robust critical thinking and challenge within and between the agencies, compounded by a failure to trigger statutory multi-agency child protection processes at a number of key moments. A need for sharper specialist child protection skill and expertise, especially in relation to complex risk assessment and decision making, engaging reluctant parents, understanding the daily life of children and domestic abuse. And underpinning all of the above, a need for the leadership and management which has a powerful enabling impact on child protection practice and creates and protects the optimum organisational context for undertaking this complex activity. Now, to just give you kind of a little bit of an overview of the work that's been done as a partnership following the release of this report. So, alongside the national recommendations, the report made a series of local recommendations for both Solihull and Bradford based on Arthur and Star's stories. Now, when looking at the report, it was agreed by partners that by examining these recommendations and reflecting on them from a North Yorkshire lens, it would give partners a really in-depth assessment of North Yorkshire's practice and enable us to really thoroughly reflect on those national partnership recommendations. So statutory partners, which from a partnership perspective cover health colleagues, police and children and family service, were asked to look through these recommendations and asked if they felt assured that the recommendations were being met, if so, to provide evidence for that, or not assured, and as such identify relevant actions to kind of address that action. This was also completed as part of a wider Partnership Day workshop and one of our biannual full Partnership Day meetings. And following this, we established a task and finish group to collate the findings and share learning. So to collate all the information that was shared as part of this reflective work, the Task and Finish group established a series of learning themes, which we've collated into a web page on our partnership website. I'll make sure the link's in the chat for you as well. We've shared the key information in relation to those learning themes, as well as resources and additional training that partners can access. Part of that Task and Finish group again was also to think about how we could present that learning in other ways, which was why we've got you all here today as part of a masterclass as well. So the themes that we collated were in relation to domestic abuse, information sharing and consent, professional curiosity and challenge, the strength in relationship practice model, that whole family think family approach, mental health, adult mental health and the impact on children, and guidance for allegations of non-accidental bruising. So I am now going to hand over to our partners who are all kindly part of this task and finish group, and they're going to share some of those key elements relating to their service. So Al, I'm going to come to you first, please.
Okay, thanks, Kat. So I'm going to go straight into it then, because we've got a very short period of time. The key themes for the learning updates from domestic abuse, what I want to cover today, is mainly, or in first case, is our Domestic Abuse Act changes, development to our governance. So prior to April 2021, all of you, or many of you will know that we had the Domestic Abuse Joint Coordination Group. Since that time, that has been developed into the Domestic Abuse Local Partnership Board, and we have a separate process now for York and North Yorkshire, whereas before that was joined with York. This allows us to have more focus on North Yorkshire, and likewise for York to have that focus locally. What is exciting for North Yorkshire, and something that is fairly unique nationally around the domestic abuse partnership boards that have been formed since the Act, is the appointment of an independent chair, for which we have in North Yorkshire. And we have a lady by the name of Cheryl Henry Leach, who has a huge impact in safeguarding children and adults and domestic abuse and domestic homicide reviews, and currently is one of the execs for APTA. So Cheryl's been in place, or was appointed in September 22, and has now taken ownership in that independent role to lead us through for the next couple of years for North Yorkshire. I think the board now has a real focus on the survivor's voice, reviewing case studies, auditing performance, and forming the next sort of stage in our domestic abuse strategy. So it's an exciting time for us. What also is in place for North Yorkshire, and what isn't, necessarily the norm across other local authorities, is a MARAC and MATAC steering group. So obviously, many of you will know that MARAC is really focused around those high-risk victims that are, likely to be victims of homicide. And then we have the MATAC, the Multi-Agency Tasking and Coordination, which looks at serial perpetrators, or serial persistent perpetrators. I think that's probably a bit of a mix of what the actual definition is. But these are individuals identified in a multi-agency environment using an algorithm and professional judgment approach. So the MARAC and MATAC steering group is chaired by myself for North Yorkshire, with a deputy chair from the City of York. I think really that has also become quite a performance-driven and understanding how the MARAC and MATAC is currently working. And as a result of that, and I'll come on to it a little bit later around the needs assessment, we've identified some good practice in MARAC and some concerns around MATAC in terms of that victim's voice safeguarding. So this is something that we will develop and create, significant improvements on as we go through 23 and 24. I'd also touched on strategy. North Yorkshire and City of York are in the process now of setting a timeline for our joint domestic abuse strategy. Some of you will know that we've got a safe accommodation strategy, which is a requirement under the definition of the Act. But this is a broad sort of umbrella joint multi-agency domestic abuse strategy. And we're now in the process of mapping out that kind of timeline for completion. So we believe that our final draft strategy for North Yorkshire will be finalised in December this year. So we're working very closely with York, and we will involve survivors. We will involve the multi-agency in shaping that and co-producing those elements of that strategy. I'm going to talk now about government funding, because as a result of the Act and safe accommodation, the government has given the Tier 1 authority, which is North Yorkshire Council, a significant amount of funding for safe accommodation. And as a result of that, we commissioned Safe Lives to undertake a strategic needs assessment and a public system review, or public health whole system review of domestic abuse. Both pieces of work have come to fruition. On the 7th of June, we had a full day with partners and Safe Lives in June, and that was an exciting day where we had the voice of survivors taking part in that as well. So strategic needs assessment was 25 recommendations. Not got time to go through them now. The whole system review was 8 themes, ranging from the whole family approach, training and culture, survivor or authentic voice. And we know that from that, we've got some gaps. I would say the gaps really that we were not necessarily surprised about was some elements of victim blaming language being used by professionals, which was, I guess, sometimes a common thread throughout some of the findings that Safe Lives did. And bearing in mind, Safe Lives undertook nearly 30 professionals interviews, reviewed MARAC, reviewed case file audits, and reviewed MATAC, and undertook a number of surveys, etc. So we've got a great deal of work as a result of the public system review and the needs assessment, and those will underpin our domestic abuse strategy as we go forward, so that we can develop quite a detailed delivery plan, probably much like what the VORG strategy takes us on a journey with. So lots of work there around the needs assessment and say it, but was independently commissioned so that we get a really good broad understanding of where our gaps are so we can work towards those. Multi-agency training, you've heard me probably speak about this in different forums. We have commissioned IDAS to undertake an 18-month program of multi-agency training for frontline professionals, which varies from children affected by domestic abuse to signs and indicators, older people, LGBT groups. So we've got about 10 modules that are in place at the moment. Anybody that wants to know anything about the training, please email me or drop me a link in the chat, and I will share with you the flyer from IDA that you can book directly onto that. Domestic Abuse Housing Alliance is another one that we're quite proud to say that we are a member of. We are seeking accreditation to the whole housing approach for victims and survivors. So ultimately, again, this is an accreditation progress through Standing Together Against Domestic Abuse. This is about being best in practice around safe housing. It looks at policy development, it looks at training, it looks at an anti-racist approach to safe housing, and it really is quite a detailed piece of work. But we have a coordinator in place now which is Joe Marriott. So Joe's coordinating that on behalf of the council. We've also created additional resilience within IDAS. So we've created an analytical role and some additional resource within their IDAS single hub. We've also, as a council, worked with Horton Housing, and they've created a GRT, a Gypsy Roma Traveller IDVA, that works across 4 sites across North Yorkshire: Carlton, Burn, Thirsk and Stokesley in North Yorkshire. And we've already seen some significant benefits in terms of disclosures from what is always a very difficult community to really get close to and support. And that's been quite a success. That's been going since September last year. And a number of referrals have come in from Helen Nakinda, who is our worker on those sites. And then finally, we have some real work to do around survivor engagement. I'm pleased again to say that at our last local partnership board, we have the voice of survivors from the Survivor Advisory Board, which is an IDAS creation. We had those survivors present at our local partnership boards. We want to increase that voice. We want to create an authentic voice post, but we're just trying to look at what best practice looks like nationally around where that sits, whether that sits with a commission service or whether that sits as a role within the council. I'm just cautious that we want to make sure that we support that individual, and we've got the skill set to do so, to really listen to a broad and diverse variants of survivors that are affected by domestic abuse, i.e. LGBT communities, our disability communities, etc. So it's a really, an interesting topic, but it's something that we just need to progress in terms of that. And that's it from me, Kat. Really whistle-stop tour. I hope I'm probably run over, because I always do, but I'm surprised you haven't just cut me off.
You've not done too bad, Al. I'm going to let you off. Thank you so much,
okay.
Al. Emma, if I can move on to you now, please. Just tell me when you want me to move across with the slides.
Yeah, good afternoon, everybody. So I'm going to talk you through what North Yorkshire Police's response was to the Star and Arthur reports. And obviously that's the first slide of introduction to myself, so you can move on, Catherine. So our response in relation to the recommendations and the findings were the following, which was to increase our child protection training and child neglect training for officers, and that's for officers across the force. That includes training from the call handlers in control room to officers on the ground to front counter officers, anybody who's in contact with members of the public and could be receiving a report of a concern for a child is receiving child protection and neglect training within North Yorkshire Police. We've also focused on recording the child's lived experiences and the voice of the child and really capturing that in the work that we're doing. We've created specific training guides and doing power hour inputs to capture most of the workforce. The training's been made mandatory by the senior leadership team to ensure that everybody is attending this training, and we've introduced the use of the aware mnemonic and a pro forma. Alongside that, in relation to the issues around domestic abuse that were identified, we have reviewed and revitalised our Operation Encompass procedures within the organisation. I'm going to move on, Catherine. So when it comes to the voice of the child and that holistic whole family approach and capturing all of that information, we've adopted the aware mnemonic. We've had really positive feedback from children's social care within both the City of York and North Yorkshire around the use of this mnemonic and them being able to understand the situation and the life of that child based on the limited interaction that the officers have had from the incident. It encourages them to record instances around the appearance, words, activity, relationship and dynamics, as well as the environment. And it allows officers to put words where the child isn't actually saying anything, so that they can convey the image that they see, they can convey the behaviours and actually share with other professionals their concerns in a way that everybody understands. Do you want to move it on, Catherine? So the pro forma itself is been developed to assist officers in gathering the relevant information, and that's what comes through to the MAST police officers within North Yorkshire, and it allows us to make appropriate risk assessments and decisions and share those with partners, and also ensure that we're getting the right response at the right time for these children. It means we can make quicker safeguarding decisions and determine where any further action may need to be taken, or where we might need to return it and get further information from the officer. It's encouraging staff to be professionally curious when they're attending incidents and look beyond the obvious, and keeping in mind that this may be the child's only chance of seeking help and support and enable them to make informed and considered safeguarding decisions. So the mnemonic itself, it guides officers very specifically around things that they should be considering when they're attending an incident. So they'll provide us a summary of the circumstances, but then they're asked to describe the scene. How does everybody present, and does the scene and the actions and words of everybody match up to what's being said? It's about listening to words. What's everybody trying to say about what's happened, and where is the child at this time? Is what's being said appropriate in front of the child, or is that causing them further trauma and distress? What are the risks and concerns? What do they see? So activity, so what are the reactions to the incident, and how is everybody reacting now, and what they're doing, and what are the officers' thoughts and professional opinions around what they're seeing and hearing? It asks them to describe the relationship and the dynamics. What's the atmosphere like? How is the child acting towards a parent and carer? How is the parent and carer acting towards the child? And an example we give is, if the child's been quite withdrawn for the last 2 days, the situation appears to be having an emotional impact on the child. the environment. So it's looking at the physical things that they can see, what can they smell, what can they hear, and what impact is that having on the child living in that household, looking at the actual physical environment that that child is living in, that daily space that child is existing in, and whether that is the healthiest environment to develop and nurture that child. So the pro forma gets them to focus on the voice of the child, thinking about that aware mnemonic, thinking about capturing the things that that the child is saying, and actually writing that down in the child's words as well, because quite often when professionals deal with children, they will translate what the child said into their own words, but we focus on getting them to actually capture what the child has said. Around signs of safety, we also ask them to look at protective factors and strengths. So what's working well, what can they see that's working well within that family unit and dynamics. We also get them to record the adults' wishes and feelings. So how do the adults present? What are their needs? How can we help them? So it's that whole family approach that we're focusing on. And what are the officers' thoughts and what action have we taken, just so that we can clarify what's their professional judgment in that situation, and what have we done as an organisation, and communicate that clearly to partners when we're sharing that information through the MAST. And next says at the bottom, the use of the pro forma just ensures a child-centred whole family approach to the incident and information sharing in response to the concerns identified in Star and Arthur. And then the next slide relates to OP Encompass. So when I first joined North Yorkshire Police, it was in September of last year, and the OP Encompass arrangements that we had in place were inadequate. So we've done a lot of work around Operation Encompass and the notifications. We've completely revised the provision that we offer. We've engaged with Operation Encompass nationally to determine what we needed to do as an organisation and what we needed to do to safeguard children. And as a result of that, we've secured funding for an officer and an administrative staff member who are going to be dedicated to the role of Operation Encompass within North Yorkshire Police. We've created a database of key adult training certificates, and we have positive engagement with the schools around this, and the school safeguarding officers within the council have been instrumental in ensuring that our communications have been sent to the schools advising them that they need to undertake this training, and the reason that they need to undertake that training is that the information that we're sharing is police information, and we're going to be sharing enhanced information, and we need to know that they are trained and know how to manage that information when they receive it. We've got up-to-date contact details for all DSLs in schools across North Yorkshire and York, and we've attended DSL training days. We now share further information until I get the officer in post. So presently, we will send out a generic notification with the child's name, the date of the incident, and a reference number to the dedicated DSLs within the school. The email that goes with that provides advice and guidance on how to support a child within the school who's suffering domestic abuse in the home, and if they require further information, they need to email back in, and those emails come directly to me at present because I don't actually have an officer in place, but by August I should have an officer in place doing that role, so the information will be able to be sent out on the first notification and there won't be the need for the back and forth. So we're still looking to continually improve. We're also doing further works with our school liaison officers. So come September, we're hopeful that all the Operation Encompass notifications, the school liaison officer will also be made aware of those. And the school liaison officer can then approach the school and they can provide a more wraparound, holistic approach to the family and the child with any further work that we can offer as an organisation. And we're also doing some work with Operation Encompass nationally because within North Yorkshire we have a number of military bases. And the military police, anything that happens behind the wire is policed by the military police, and quite often we don't hold that information on our systems, but those children still attend schools within North Yorkshire. So we're doing a lot of work with them, educating them around Operation Encompass. We're giving them access to some of our information and training, and we're hoping to be able to open up the lines of communication between us and them to ensure that those children aren't missed in this process because they live on a military base. Any questions?
Thank you so much, Emma. I'm going to ask partners to just take questions at the end, if that's okay.
Oh, no problem, Catherine.
Al, I'm just wondering, there's a lot of people asking in the chat about the link for the IDAS training. If you can find it, can you pop it in the chat for me, please? And then people can just access it. Thank you so much for that, Emma. I am going to pass on, if it will let me, to Claire. Claire, are you happy to go?
Yeah, fine.
Thank you very much.
Hi everyone. As I said earlier, I'm lead nurse for Safeguarding Children in Care for HDFT. Just really quickly, a background of the organisation. We don't just cover North Yorkshire, we cover Northumberland, Sunderland, Gateshead, County Durham, Stockton, Darlington, Middlesbrough, North Yorkshire and Wakefield. So with quite a large safeguarding NHS team, are possibly one of the largest in the country. So with that comes a real luxury of kind of learning from other areas, whether that be serious case reviews or innovative roles and ideas. So I'm just going to talk to you around our new innovative roles, which links to the fact that the national panel recognise that the child protection work's often complex and complicated, and we were often sending out inexperienced staff to manage these cases. So exactly like next slide, like we're back in COVID. So we've developed a Band 7 specialist nurse for complex safeguarding, not with any additional funding, I have to say. We've skill mixed from our school nursing service. So it's the first time that I'm aware of that specialist nurses for safeguarding within the NHS actually go out and see children and also go out and visit homes. So they're there to oversee the complex cases, but also to oversee our Band 6 strategy nurse roles. We hear a lot that it's management oversight. That's not very good in safeguarding. So the management oversight is very robust. The most exciting thing is we've developed as part of her role, again, going back to what Emma said, really concentrating on the child lived experience work. And this role provides day-to-day supervision to those staff. And also, at the moment, I am supervising the Band 7 complex case role. So in my role, I'm supervising them on a weekly basis, again, to ensure that there's that management oversight, any escalation or any professional challenge happens. They attend conferences, and they also, obviously, as I said, strategies, etc. But the most important thing, I think in the last 6 months in one area, one of the Band 7s has seen 72 children alone. So that's really great news. Just don't move on, Kat, if that's all right. So we've also, as I say, created a standalone child lived experience practitioner, Band 4. This is to complement what the local authority social workers already do. However, we've made it a standalone role. We are very much concentrating on the tools that we use with young children, which I've got a few examples of. We haven't rushed out and done the 3 houses with the children. We tried that in the first kind of contact. It always seemed to make them a bit nervous, especially the younger children. So we've developed age and stages tools and games to pictures to actually get the voice of the child. Now, the impact of these roles has been absolutely huge. We've had so much feedback from young people. We've had so much, unfortunately or fortunately, disclosures from children for the work we've done. And we have had national praise more recently from the national panel. I went down to the national panel conference a couple of weeks ago in London. It was quite surreal, really, because I was actually face to face with Annie Hudson, the chair. Gillian Keegan was there, the Secretary of State for Education. And during the workshop in the afternoon, they were really, really keen in getting more information on these roles, and they have asked for my contact details and email address. Move on, Kat, please. So yeah, so we've also, what we've done is, I feel like I'm John Major saying this, but we've gone back to basics. So our staff are spending lots and lots of time record keeping, especially on the electronic record, and basically they were spending more time documenting the visit or the contact than even seeing the child. So we've reduced down the and changed, once a child gets to the level of safeguarding and strategy, we've changed the health needs assessment to be more focused on a safeguarding needs assessment and a child lived experience needs assessment, and really reduced it down. And the feedback from the staff is absolutely amazing. They're able to see loads more children because they're not going through that bureaucratic, lengthy documentation. Just move on, please, Kat. Probably cannot say this, it's quite small, but as I said, we've been so successful with these roles and getting disclosures, that we've had to create a disclosure pathway, obviously to keep the children safe, but also to keep the staff safe. You know, we didn't want, obviously, when a child discloses, for the practitioner to then inform the parent what the child said, because obviously that puts the child at greater risk. So this is the pathway that we have got in place, and I'm happy to share any of our work wider, because obviously it's all there to protect children at the end of the day. Just move on, Kat, thank you. So this is just a few examples of what the girls are using, girls, boys. We have got a male strategy nurse in one of the teams, which is brilliant. So we tend to go with more basic stuff, like the feelings thermometer. Move on again, Kat, please. People will have seen things like the fairy and the wizard, of things that's going well, what the worries are, what the wishes are. Next slide. And again, this works really well, looking at home, whether they're happy, sad, and all about the friends, and we use that quite a lot. But I must say though, once we get the voice of the child in these tools, we then actually attach them to the record, and we do also use them as part of the, if we're going to conference, for example, we use it as like information in conference, because when you see a child's own handwriting, and often we're finding that when they're worried and they're upset about something, they'll write that in a black pen, but then when they're happy, they'll start using colours. So I think when we're presenting that at ICPCs or even strategies, it's really, really powerful to get that voice of the child. This is just, obviously, again, I've said we've had some lovely feedback for the staff. This was a 13-year-old girl who was getting exploited, or probably is still getting exploited, but the complex specialist nurse has done a lot of work with her. So she's saying, thank you for always being there when no one else was. You've really helped me in the past 3 months. You've never given up on me, even when I didn't believe in myself. Thank you for putting up with my disgusting language, and you helped me with stopping smoking. You helped me get over my fear of getting the implant back in my arm. You are an amazing, kind-hearted person Please don't ever let anyone tell you different, because when I felt like giving up, you saved my life and I can't thank you enough. So again, we've got like lots of examples. I mean, we've had visits from our chief execs from Harrogate up into the northeast contracts, and the team have shown them what the children have written and what they've drawn, and they've actually been in tears because it's been so powerful and really shows the impact that these new roles are having really for children and young people. So
thank you, Claire. Amazing. Thank you. I love that slide. I think I want to keep that forever, that one. Let me just move on to the next one. Elaine, if you are ready to present, please.
Yes, I am. Yes, so obviously we've been part of the partnership working, and obviously we have embedded the 6 learn themes from the 7-point briefing across our organisation. You can move on, please. So I'm going to go through each one of the themes and what work we've done. We have 90 services in place that we have to cover, and we go from Darlington, Durham, not just North Yorkshire. We go to Teesside, which is North and South, which is Hartlepool, Stockton, Middlesbrough, Redcar, Cleveland. Then we also have North Yorkshire and York within that also. So as part of the themes, domestic abuse being one of them, we continue to work in partnership with multi-agencies to support the service user and members of the public. And what we do, we're taking part in all the multi-agency audits at the moment, so we can all come together to look at the good work and the negative work that, you know, where we can improve on within services with all our multi-agencies. We have dedicated MAROC advisors within the safeguarding team that provide all the information, and that includes the voice of the child within that. We do support with domestic abuse and attend all the MAROC meetings where needed. Unfortunately, we do have a little bit of a capacity issue at the moment, but we are sending the information for those meetings. We do attend the internal and external training, and we do offer bespoke domestic abuse training across the trust where it is needed. We have a new level 3 safeguarding training package, and domestic abuse is embedded within the training package. Now that came into play from January of this year. It's a full day package, which is online, and we are trying to move towards face-to-face as we can, but unfortunately a lot of our feedback forms are saying they prefer the Teams way, but half of them are saying they prefer face-to-face. Obviously we're still getting over the COVID effect and things, so we are now starting to offer face-to-face training within areas, 2 a year I think within each area. And we do offer domestic abuse supervision for all staff across the trust as well. If you can move on, please. Information sharing seeking with professionals. Obviously we follow the GDPR, as we all do, the Data Protection Act and Human Rights Act, when we are sharing that information and when we're seeking that information. Really important, because a lot of staff still don't understand that we can override that even if we have not got consent, if we have significant concerns. So we're really trying to get that message out there. We do ensure that the information that is shared is proportionate to what the concern is, and it's shared with a need-to-know basis. So if we do ask for information from other agencies, we won't just, you know, discuss it with somebody with maybe on reception. We will say, speak to the safeguarding link within that organisation, so that we're not sharing with information that on people who don't need to know. Making sure that the information is accurate, up to date, shared in a timely manner, and that there's no increased risk of harm to that individual who would be informed that the information has been shared. And obviously we're aware that we don't share it if it's not needed. Ensure it's recorded in line with the local and organisational procedures, and ensuring that the outcome is recorded. And I have just been part of some of the audits we're doing within York and North Yorkshire, and we're starting to see that all agencies, there is that gap, as Alan said earlier, that we're trying to, you know, how do we get that information? One, if that child or that patient is not open to us, how do we get that information? And we're starting to come up with ideas such as, let's get the outcome to agencies so that we can have the outcome to see, you know, because we thought about, you know, do we let, you know, to see if that person is open to that agency. We all haven't got the time to do that, we know that, but we came up with maybe a suggestion of coming up with outcomes just to check that it would go to the safeguarding teams, and then we can check if that patient is open or closed to our agency, because we're not getting a lot of information through. The information sharing and seeking is embedded again with our safeguarding training and supervision across the trust. Again, as Emma spoke about earlier, I do like the aware that you're doing, which is great. Again, we're looking at that professional curiosity and challenge. We embed that across all of our training packages. And I know some of you were on the PAMIC training we did yesterday. And it's that voice of the child and not doing the tick box exercises, what we was trying to say. It's about the curiosity, the whys, asking the relevant questions so that we can really make the children at the centre of what our safeguarding concerns are. And strengthen relationship practice, that again, whole family and think family approach, which I did talk about yesterday also with the PAMIC, and it's that strengthen relationship practice model. And we've making sure that again, instead of having, even though we have separate safeguarding adult and children teams, we come together very regularly with our huddles and talking about that think family approach across both of our teams. We can move on, please. The mental health support include the impact on the adult mental health on children. So we again have embedded it in the packages, and we're certain that the children, and it's about that impact on what the child is from any mental health concern. We encourage the PAMIC, as I've said, about anyone who has care and responsibilities. So not just parents, it could be any caregiver who might have children who they look after maybe for a week on holiday while a parent's away. So it could be aunties, uncles, grandparents, anyone who has mental health issues and they have care and responsibilities. We are getting a new recording system within TUE, which does embed the parental mental carer, mental health and the impact on children. So we are looking at new systems, and I know some other areas are getting new systems in place also. Our new system is going to be called CETO. So we may have a few problems over the next couple of weeks while we're getting the new system. They've been on it for months and months, but we're getting the new system that's going live, I think, on July the 1st, all being well. So we're trying to get all staff in place with that, so it's all up and running. So sometimes if you are asking us for a request for information, we may not be able to get that information to you in a timely manner over the next few weeks, but we will try our best to overcome that. Guidance for non-accidental bruising in children. It is provided by the Safeguarding Children Partnership. And it's been disseminated across the trust, including to the link professionals, where we are offering 6 sessions now instead. So we've increased that from 2 sessions that we were offering a year. We've now increased that to 6 sessions where we embed themes and come up with new themes across the trust for each year. And we ensure that the guidance is easily accessible across the trust and is communicated widely also. I think that might be all of them, Kat, from our side.
Yeah, thank you so much, Elaine. Jo, I'm going to hand over to you, please.
Yeah, so I'm Jo, like I said, I'm the Children and Families Principal Social Worker, and I'm just here this afternoon to run through a couple of slides about the Strength in Relationships practice model within North Yorkshire. We've heard through the review that information sharing is vital, that robust professional critical thinking is, that we need to understand all of our expertise and also the expertise of the family and the decision making we and them can make. We need to be working with parents and understanding their daily life experience and that of children as well. And we need to have a whole heap of curiosity and questioning approach, and having multiple truths. Everybody's got a truth, and that's fine, because it helps us be hugely curious and determined to support families in the best place that we possibly can. So in January this year, we updated the practice model. So you can see at the bottom, it says that it was updated January 2023. And I'm not going to run through it in totality, but you'll see it's a strength-based practice model into assessing risk and supporting change in families. So we've got the systemic, we've got the signs of safety, we've got the 3 intentional behaviours, working with the whole family, agents of change, and working to identify strong relationships. A change to this model in January was the arrow where we've got relationship continuum. It used to be restorative, but we're really digging into relationships matter and everybody counts. And we had 6 objectives, and we've moved to 7. And the 7th one is making the child's voice really count, and the use of mind of my own. That's a practice, not a product, that we use now within North Yorkshire, and hopefully you guys are more than aware of it now. So clearly we work with partnerships, and when we're thinking about the practice model, just to let you know, within the council we have over 55 family seeing coaches supporting our practitioners in children, young people's families, understanding the trauma-informed health lens, understanding how best to support colleagues thinking different about ensuring that we're admiring and seeing the family and the network and the children's views and voice before us, understanding people can change and understanding how they wish to lead their best life. So we're very much moving towards a dignity-driven capabilities framework after understanding risk and safety first. We are also starting to collect a small group of parents and carers who we're calling experts by experience, to really hear from them about how we can continue to improve and change, to carry on being curious, kind, hearing them and their children, and understanding the risk and how we can work together with them collaboratively, and clearly with you guys as well. So if you want to move on, Kat, please, that would be great. So here we go. Here is some systemic thinking. So underpinning the strength in relationships model, we're thinking about multiple truths and the full thick story. We all understand that we limit success and outcomes if we only have single stories. And some of those single stories that a colleague of mine in America, Kevin Campbell, who is one of the model authors of Family Seeing, Family Finding, will say, some of those single stories we'll all be mindful of is the child has no one, mother's dangerous, the whole family are addicts, the father's burnt his bridges, or hashtag they don't have a dad. And we need to be really curious and understand that people say those things for a reason, and we need to understand what that reason's about, and dig deeper and be more curious and more dignity driven in our practice to get to why they're telling us that. So when we're moving into strengths in relationships practice model, we're then all producing fuller, thicker stories. We're considering the layers. We're understanding the capabilities and gifts people have if only we were to ask. And some of the findings were about working and understand what the family and the network and the children wanted to say. We build trusted relationships, offering hope and admiring future potential, and understand that everybody's voice counts. So there are some ideas on this slide here about dignity-driven practice and strengths in relationships and intentional strengths and questions. But ultimately, we also need to be honest with ourselves. We all come to work each and every day, I am sure, to provide our best self. But our self involves our own social graces, the power and privilege we have with a lanyard around our neck if we want it or not, we need to understand it and be respectful of that. We need to understand diversity and difference, and we need to understand our own biases and the unvoiced biases, and understand that we will all work within the quadrant of safe uncertainty, which is Barry Mason's work. So we need to have enough safety and enough uncertainty to work with family. So we're looking at how we can produce and support them to be a safe and have the best life that they want to live. And that's me, Kat.
Thank you so much, Jo. I'm just going to move on to the final few slides now. I cannot believe we have almost got there in time. That's amazing. I don't propose to go through these questions, but I think given, you know, we've had such amazing feedback from partners today, my ask from all the attendees today would be to really kind of think about how you disseminate the learning that you've picked up today. And these questions for reflections were ones that came out of the report. They are available on the webpage where we've collated all this information, and I am going to pop that in the chat in a minute. But yeah, my ask to you would be to take these questions back to your team and have some of those reflective discussions and see if there's any kind of additional learning or training or resources that you need as a result of that. And again, you can always get back in touch with me or the partnership, and we can look at additional training that we can put on. Finally, from me, a reminder, this is our webpage. Like I say, the link will go in the chat in just a second. What we will do is this session is recorded, so our slide deck will go on the webpage, and we will also have a recording of this session which we will put on our YouTube channel, our North Yorkshire Safeguarding Children Partnership YouTube channel. Again, we'll pop the link. It's really useful to like and subscribe to that, because then you'll get notifications for any other webinars or sessions that we share. Finally, from me, I just want to say an enormous thank you to all of our partners. It's been such a joy being part of this true partnership work here, really covering this very important work. So massive thank yous to Al, to Emma, to Claire, to Elaine and to Jo. I'm going to pop these things up in the chat now, but that just leaves us then with a few moments just at the end of the session if anyone would like to raise any questions. I will put the survey link in the chat as well, but I will stop presenting and I'll turn my camera on, and then if anyone wants to have any discussion or question, partners are here for you.